Hi everybody, it's Dr. Magnifico from Vet and Probably.com. I am at my house and this is my cat Jitterbug, who's sleeping in the windowsill because it's about 100 degrees outside. And I thought I would do a little video on well, this is sort of acute and chronic vomiting in cats. So I get a lot of questions about my cat vomited. And here is Jitterbug lying in the window next to a pile of vomit. So some of the important questions to ask your vet if this is happening to your cat are the following. Do they do it consistently? Meaning, what's the time frame? How often? How many times a day? How do we understand the severity, the degree, the chronicity, and the severity of the vomiting? In my cat Jitterbug, he is an indoor-outdoor cat, so he came to me from the woods far away out there when he was a very young cat. He still is very difficult to make a house cat, so he does not want to stay inside. He really prefers to come and go as he pleases, and that means that he will be out all night on the really hot days. So he's out all night and then he comes in the morning, which is really not my preference, but really difficult when you had a cat who's been a feral cat in the past. So last night he was out all night. He came in about 4 o'clock in the morning when I went looking for him. And then this morning he ate a huge volume of food and then he vomited it. So I know it's gross, but here we go. This is undigested food and it's in a long, narrow tube, meaning that was what he put too much food into his stomach and then vomited up rather quickly. So if you've got a cat who's doing the following: goes to the food bowl, eats a very large meal, so consumes a lot of food in a very short period of time, and then within about a half an hour vomits it up, it probably is just a cat who ate too much too fast. So I'm sure he was hungry, but when he got in this morning, he ate a huge volume of food and then he vomited up because it was more food than his stomach could handle. So here are the important things. He is otherwise normal. So he's happy, active, playful. His gum color looks good. So if you look inside his gums, he's nice and pink. He's got a nice, calm, resting heart rate and respiratory rate. He's not losing weight. That's a big, giant indicator. He's maintaining weight. His coat looks good. So those are all signs of a healthy cat. And he's acting normally. And then every once in a while, even if it's every morning consistently or every evening consistently, you see a big pile of undigested food. Typically it's about the same amount. It's always undigested, meaning it looks like the dry food that he ate not too long ago, and it's happening within 30 minutes, maybe even an hour of eating. They might be eating too much too soon. So some of the things that I talk about are try to switch them to wet food. So you can do wet food, add water to it. The water makes it easier to digest, and it also makes it makes it go into the stomach and out of the stomach faster. So a wet food diet for a cat his size, and he's about 8 pounds, which is a normal cat size, it would be 1 can with water. So you kind of make it soupy. That will help slow down their ingestion rate and it makes it easier to digest twice a day, and then minimize the dry food. Or even more than that, you can do small feeding. So a half a can every 3 to 6 hours if there's no vomiting in between, and see if that helps reduce the vomiting. This is really just a case of a cat eating too much too soon, not able to digest the food because he's consuming too much too fast, and then getting vomit. But as long as he's not losing weight, as long as he's not repetitively vomiting, meaning he vomited once to get rid of this food that was too much for him to handle, and then he's not vomiting anymore, you can just try this at-home method of trying to slow down the amount of food that goes in and slow down the consistency of hard, dry food, and see how they do. Certainly, if you've got weight loss, if you've got a cat who's consistently vomiting, if you've got a cat who's vomiting foreign objects, meaning stuff that they shouldn't be eating, those are all really good indications that it's time for you to see your vet, and you should see them ASAP. Chronic vomiting in cats can be a really big problem, but typically I talk to them about, is your cat eating too much too fast, and maybe that's why they're vomiting? Or are they getting into something that they shouldn't? Or are intestinal parasites a problem, which for cats that go outside is a very true reality in a lot of them. So make sure you talk to your vet also about a fecal sample to make sure there's no intestinal parasites going on. One thing I always need to mention with intestinal parasites is that you won't see them in the feces quite often. So you need to bring a fecal sample to your vet for a microscopic analysis of the feces to see if there's intestinal parasites, because that's a really common condition for cats vomiting, especially if they're outside. So if you have any questions, you can reach me anytime at Vet or Probably.com. I really love the cat questions, so keep them coming. Take care, you guys. I'm going to go clean up his vomit so he doesn't have to sleep next to it. Take care. Bye.